the best and worst of Hollywood birth movies. Hi there, it's me again. I'm Tuly Duprat, I'm a doula and midwife, and we're here to talk about birth on Hollywood scenes. It's cringing and skin crawling to me to watch birth scenes because they're so not well done. We have a few good scenes on Hollywood movies, I would say, but you can count in one hand for sure. And we're gonna go through them and we can talk about the good parts, the bad parts. So we're gonna start with one scene of a movie that is called Prometheus. And it's a very interesting scene. In my opinion, it's one of the worst scenes of Hollywood movies ever. And it's a scene that she has an alien in her tummy, and she needs to get the alien out, so they have a machine, and they will have basically a C-section, like an automatic, automized machine that does medical procedures, and she will attempt to remove this alien out of her. And we can go through and then we're gonna talk about part by part of other things that are crazy and interesting, and we're gonna see.
Running diagnostics. Come on! Get out! Come on! Oh God! Come on! Initiating anesthetics. Commence surgical procedure.
First of all, anesthetic, it's like a spray of some sort, that is not doing anything for her. So if you don't have an epidural or a spinal, that will not do a thing for the major abdominal surgery, which is a C-section. And it's just crazy that someone would function even feeling that pain. So that is definitely a red flag that the scene is just gonna continue to get worse. Like, where's the placenta? She just grabs the umbilical cord and rips it out from her belly, and she just rips it out. Her umbilical cord was nothing. That stuff is thick. We're trying to cut it with a scissor, and we have a hard time sometimes to go because it's super chewy. If you cut an umbilical cord before, you will definitely know that it's not you cannot rip it out. It's a lot of work to rip it out like that. And that is an infection for sure. That is not very well sterile filled. No, then what it happens, you have like 7 layers of tissue to suture for an incision like that, and what they do is just they clamp it ta 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 all over, and then it's just like, that's it, that's done, we're good. That's not how it's done. That person is not gonna recover. You're gonna have a uterus that needs to be sutured. You have layers and layers of muscle, fascia, and skin, and all of the other things in between that need suturing to be able to recover from something like that. It's not like a series of clamping going on the top of the belly that will do what it needs to be done. That's crazy to me that they would even try to do that. And then she's like, while they're doing that, she's like kicking and screaming at the same time. Like, the abdominal wall, it's open. She just went through surgery. That's totally nuts. Totally crazy. It's totally not real. And then what does she do? She just run off like was nothing. Like, she just didn't have major abdominal surgery in herself, and she just didn't have an alien baby that was eating her inside or something, and then she just ran off, which is amazing. Crazy to me that someone would even put something like that on video. Crazy. So for all of those reasons, for me, this is the worst Hollywood birth scene of all times. And I don't know if you guys agree. You can comment below. Let me know what you guys are thinking and what I mean, that this is beyond. I don't have even words to say how bad this is. Yeah. Prometheus was 2012. Please don't see. If you're gonna have a baby, don't watch it, but it's fun if you're went through surgery, or if you know how it's actually done. If you're a healthcare provider, it's just like the amount of gibberish that this scene has, it's crazy, amazing, and weird all at the same time. So the next one, it's a one that I feel it's an okay scene. It's from Bird Box, and it's from 2018.
It could be a false alarm, right?
All right, we're going upstairs to the bedroom now. We need towels, sponges, scissors, and lots of water, buckets of water.
See? She knows what she's doing. Scissors, water, clean towels, all of the things we need when we're having a baby at home. Like, they don't have a midwife, they don't have anyone else other than she's the most experienced person on the group, and she's given directions, and those are definitely things that I would grab to have a home birth without medical assistant.
It's okay. It's okay. It's okay. It's okay. Take it easy. I got you.
That was a lot of water, let me say that. That was like a long time dripping. Yeah, it's very good timing though. They're having the babies at the same time.
The scissors are in the drawer, right by your left hand, yeah.
Okay, so baby's coming.
No, not happening.
No,
Not happening. Not
definitely,
happening.
definitely coming. Here, come with me, come with me, come with me.
It's not happening. It's not happening.
It's happening. Come on, hey.
I have to do the water.
We'll do the water. You two doing great.
Oh, shut up.
One more time. It's a boy.
Your auntie thought you'd be a girl.
That's right. Yes. Yes. Oh.
You did it, Mama. You did it.
Hello. You look so beautiful.
What's going on down there?
Can I see?
Yeah, so overall, it wasn't a, I feel it was a very realistic scene. There was not much pushing though. I would expect to have some bearing down, some really kind of like the body's asking for that pushing stage, really more bearing down overall. But other than that, it was pretty realistic and well done. It was really short because, I mean, you're not doing like a 2-hour scene for a birth in the movie. But other than that, I feel like was really how someone would have a baby at home in terms of not having equipment or all. And everything went totally great, and babies, they were nice and pink and breathing right away and crying, which was very nice. Yeah, and definitely something you can do in your living room. Your body can do it, you can do it, and it's very natural, and it's been done for thousands of years in people's houses. So I feel it's a great representation of a very natural home birth with little assistant. But she did a great job there being the midwife, which was good. Thank you for watching, and leave your comments down below, ask me some questions, subscribe, and next time we're gonna have some more fun together. Thank you. Just a little disclaimer, does not constitute medical advice. This is based on my personal experience and the knowledge that I got along the years. And even being a midwife, I'm not your midwife. So it's important, if you have questions about any of those topics and any of the things that we discuss in those videos, that you talk with your midwife or your provider about it. And I'm happy to answer questions, but it's always based on my clinical experience and my personal experience, and not in your case and your body.